Hi there, my name is Mike Plackey. I'm a physical therapist at Plackey Physical Therapy. And today I want to talk to you about why I treat coccyx, or the tailbone. The tailbone is, I'm going to call it the coccyx. The coccyx is this little upside down triangle at the very base of your spine. Okay? Just above that is your sacrum and your innominate bones on either side. And this is your SI joint on either side. Between the coccyx and the sacrum, there's actually a joint right in there. So everybody should have some mobility available at the coccyx. Problems happen when people fall on their tailbones, which I believe almost everybody has in their lives. When my twins were 1 and they were learning to walk, they would fall on their tailbone about twice every 5 minutes each, you know? So people are constantly, even when they're young, they're falling on their tailbones and traumatizing that area, you know? Or say you're snowboarding, another common way to traumatize your tailbone. You fall on your tailbone and you hurt it that way or injure it that way. When the tailbone gets landed on, it's sore for any time, you know, any between maybe 2 days and 2-3 weeks sometimes. People can't sit, they're so sore. And then one day the pain kind of, a lot of times, will go away and people will forget about their tailbone. The problem happens though when people land on their tailbones like that and they shift that tailbone slightly out of position. Maybe they cause it to be tucked under them a little bit more than it should. Nothing ever acts on that tailbone to cause it to go back into the position that it was in initially. And nothing ever acts on that tailbone to mobilize it so that it regains its mobility in all directions, which is so important. So that tailbone then becomes a stiff anchor, and it anchors down the sacrum, it anchors down the pelvis especially, a lot of other areas as well. But this whole pelvis will get anchored down and it will stop moving. Pelvis needs to move for the back to be happy, okay? If the pelvis is stuck, the first place people start to move in that situation is frequently L5-S1, fifth lumbar vertebra in the top of the sacrum. And this is the most common area to have a disc problem. And disc surgery frequently, or fusion, happens here more often than any other spot. People tend to they tend to move excessively at this area because of the fact they're so stiff here. The body compensates and moves excessively at L5-S1. You start to get degeneration and disc problems there as a result. So when a patient comes in for treatment and they've got an L5-S1 disc problem, I'm not going to necessarily just look at the L5-S1 as a clinician. I'm going to look at what is causing that. You know, this is the symptomatic area, but where's the cause? I treat, or I check the tailbone on just about every back patient that comes in, and I will check the tailbone in a non-invasive way to see if it's rotated one way or another, to see if it's deviated left or right, to see if it's tucked under, or if it's sheared in any particular direction from any type of trauma. I do functional mobility tests with the patients, check their core strength, some other things, have them lie down. I assess and treat the tailbone. It takes maybe 5 to 10 minutes, depending on what's going on. Get the patient back up, and almost every case, the patient moves better after they're done. When they get up, the pelvis moves better. The range of motion in their spine is frequently better. Sometimes the range of motion in their neck and the arm is raising over the head is better. This is such an amazing area. It is such a culprit. It causes problems throughout the body. And when it's treated, many areas in the body move better, and it's such an important area to have assessed and treated if you have any type of chronic pain especially. It can be the difference between you having to have surgery and being able to avoid surgery, the difference between being able to get off your pain medication or not, being able to avoid chronic treatment over and over and over again to the same area. So you can finally take over and have relief and take over treatment yourself and be more independent. But the causative areas have to be treated by a skilled manual therapist. Coccyx is definitely one of those areas, one of those culprits that needs to be treated. If you'd like to get hold of me, my number is 916-221-8534. My website is www.plackypt.com. That's P as in Peter, L-A, C-H-Y, P-T as in physicaltherapy.com. Email Mike at plackypt.com. Thank you so much for watching today. Have a great day. Take care.